Hi, this is Dr. Darwin, a new dentist coach, with another edition of Ask Dr. Darwin, where you ask questions either about your dental health or things that you want to maybe see for yourself or health-wise, but also for new dentists that are exploring the career of dentistry, whether it be as a pre-dental student, as a current dental student looking to getting ready to graduate and get into residency, or also as a new dentist that has graduated and maybe transitioning into private practice. So welcome. Please, if you like this video and you know someone else that can benefit from learning from this video, please subscribe, put some comments in and like it, and then also feel free to share with others, as I will be posting these types of videos every Monday. So on today's episode of Ask Dr. Darwin, we're going to be talking with a pre-dental student who has some questions about her upcoming interview that's coming up in about a week, and has some questions about other things pertaining to her application that she wanted to get some help with. So tonight we're joined with future student Dr. Mercedez. How are you? And welcome.
I'm doing well. How are you?
Doing awesome, especially now that we've connected and have the opportunity to talk to you. So tell us a little bit about yourself and how you found dentistry.
Okay. My name is Mercedes, and I graduated from undergrad in 2014 with a bachelor's degree in nutrition. I then went on to receive my master's in public health from Boston University. My interest in dentistry started such a long time ago, maybe when I was like 12, 13. I had an underbite growing up, and this underbite caused a lot of lack of self-confidence, and it was one of those things that when kids saw it, they would laugh at me,
Mm-hmm.
And so I went to a dentist and all of that, and they referred me to an orthodontist out at Tufts University. And from the day I met my orthodontist, I probably was 13. I decided that I was going to be a dentist because of how much compassion she showed me. I've never received so much compassion, so much concern, so much dedication from a healthcare provider. And having somebody give me all of that, especially in a place especially through something that made me feel the lowest, it was just beautiful to me. So from then, I was like, I'm going to be a dentist. My parents are from Ghana, and they're like, dentistry, what's that? Why don't you be a medical doctor? But I told them, I'm like, this is something that I want to do because of the experience that I've had, and I'm here now, and I'm so grateful that I've been given an opportunity to interview at a school, and it's actually my dream school. It's the school I actually want to go to. So I'm very excited about that, and I'm just hoping that on the day of the interview, they'll see how much passion, how much drive I have to add to the field of dentistry.
Wow, that's an amazing story. Amazing story. One of which that's common for a lot of people who end up pursuing careers in dentistry. They've had an experience as a kid or maybe as an adult that opened their eyes or just kind of changed their perspective or them as an individual completely. So that's so amazing. Hopefully you included some of that story in your personal statement. Also, I'm sure you found
I did. Yeah. I actually did. Yeah.
Good. That's awesome. So tell us a little bit about the interview process that you've been going through. Is this your first interview? This is one of many interviews?
Yes.
How's it been going for you?
No, this is my first interview. So I'm gonna share everything. So I applied last cycle to dental school, and I applied late. And my DAT scores weren't that great either. So it probably wasn't only because I applied late. And I So I didn't get any interviews last cycle. I got rejections. And so I was like, okay, I'm going to do this again, because this is something that I want to do. There's nothing else that I can see myself doing. So I'm going to do this again. So I had applied early in the cycle this time around. I didn't retake my DATs, which I probably should have, but I'm like, okay, I'm going to try this again. And if I don't get any interviews or anything, then I'll definitely sit and take my DAT over. So I applied to Meharry Medical College, and I applied early, so I didn't hear anything back until I think it might have been January 31st, or I don't know.
A couple weeks
ago. It was the last week of January. Yeah. So up until then, I was like, okay, maybe I'm going to have to do this all over again. I was considering taking extra classes to improve maybe my academic record, take my DAT over. And so, on a random day, I was just checking my email and I saw that Meharry had invited me for an interview. And I was like, oh my goodness, this could be real, I can be in dental school come the fall, so I'm just so excited and anxious because I don't know, I'm just so excited. They've given me the opportunity to come and share and show myself to them, and I'm just so grateful for that. And I'm hoping that I can do my best on that interview day, and hoping that I'll get admitted to that school.
That's great. Yeah, I've got we have some residents that are graduates of Meharry, so that's great that you have been granted an opportunity to go down there and show them who you are in person, not just on paper, but in person. So that's going to be key.
Right.
That's going to be great. That's going to be great. So this is your first interview. Haven't done it before.
Yes.
I'm sure you've applied, you applied to college and also for your master's program.
Yeah.
So you've interviewed before, but not with this type of, professional development opportunities. So what are some of your questions? What are some of your things that you're thinking about right now?
No. Okay, so I have a mentor, and she actually attended Meharry Medical College, and I spoke to her, and she kind of encouraged me to bring my CV along with me. That wasn't actually something that I was planning on doing before she brought my attention to it, but I'm looking at my CV now, and I'm it's practically based towards work. It's not really dental related. So I don't know how I should tweak that, or should I just bring my work resume? I don't know how to tackle that.
So a couple things. Quick answer as it relates to it. A couple things. It really depends on what you have on your CV. Even though that you said that it's
okay.
It's related to your work experience. With your MPH, if you have been working in that area or that part in that area recently, that is of interest for those that are that are applying to dental school and then actually are going to graduate, matriculate and graduate into dental school, because that's an area that some people will go into. Some portion of that MPH you will be utilizing a lot. So that may be of interest.
Mm-hmm.
That may have been one of the reasons that schools are interested in you as it relates to the public health and having that training in that area. So without necessarily seeing what's on your CV, she may have said to bring it for a couple of reasons. One of which, if you included it in your application, they already have your CV. So they may try to look at it and, maybe reconfirm, or actually that could be sources of questions. As you're telling them about you, they already know some of your background based on your personal statement and also on your CV. So if anything, you should know your own CV front and back as to, the information that's there and how it may be used to kind of facilitate discussion and conversations during the interview. So bring it in a sense, and bring it in a sense that you kind of know it inside out, okay? But also, they may ask you to talk about some experiences that are on your CV and maybe go a little bit into detail, especially as it relates to the whole notion that dental school and actually the practice of dentistry is very challenging. It can cause conflicts, and they may ask you a question because they may want to know how you would be able, as a dentist, how you would maybe answer or come up with a solution to something that's challenging within the profession. And you may have some direct work experience where you can actually give an actual example of something that you're working in within, public health or what you're doing currently right now as a predental student.
Okay. So because I don't know, I was thinking that maybe I should reformat it so that my dental experiences are in one section and my work experience is in another. I don't know. I'm just at this weird place. Maybe I'm just overthinking it because she suggested it. Now I'm like, oh my goodness, I need to.
Did she say why?
But I mean, she just said like just bring it and like give it to the interviewers. I don't know.
Okay, well, first, let's do this.
I'm gonna bring it.
Bring it. Ask her why. Ask her why she made that comment, because it may be something very specific. That she's pinpointing that maybe just got lost in part of the discussion that you guys have. So I would first contact her and get back in communication and ask her more specifically. That's a great suggestion. What are you thinking? Why should I bring it as relates to you mentioning it? Now, the second thing is, did you include it as part of your application process?
The ASDA Access application, like they just ask you to input all of your experiences. So it's not like you would upload your actual CV. You take things from your CV and you put it in the application. So technically they really have everything that's already on my CV.
Right.
So I don't know.
Right.
Yeah.
So if anything, I would tell you, you may not necessarily need your CV outside of the fact that everything that's on there, it's in your application. So if you have a copy of what you saved before you push the button and sent that application, that standardized application form, that's what you need to look at, because at the same time, that's what they're going to be looking at right in front of them. So whatever they're looking at is what you should be referencing as it relates to you telling your story and maybe talking about your experiences. So I think either or is fine, but I think if they don't have your CV, but they have the information off your CV that's in a standardized application, I would say if you have a copy of that, bring that.
Okay, I'll do that then. I can just download it off of the application portal, and I can just refer.
There you go. Yeah. Another thing that I would tell you that you want to have, that you should bring, is you should bring a list of questions. A list of questions.
Okay, yeah.
Have a list of questions that you're going to be wanting to ask the admissions committee. These should be questions when you're looking for answers that are not necessarily already on the website of the schools you're interviewing for. This has to go a little bit more deeper.
Okay.
A little bit more deeper into questions more specifically about, maybe about the school. You may have a chance to talk to some students. So some questions you may that you may have may be more related to student life and more specifically for the students the first or the second or third or even the fourth year students. So hopefully you'll get a chance to interact with them. I would encourage, if they don't have it already laid out in the format of your interview day, I would encourage you to ask them if you can meet with, several of the students first and second year, just to see, how they're doing, and, so you can ask more specific questions of them. That's very important.
Yeah, I think they said that there will be a tour. So I'm assuming that the tour will be led by current dental students.
Yeah.
That's what I'm thinking.
Okay. Well,
I'll ask.
Yeah, even if it is, you still want to have a list of questions for the admissions committee members that are going to be talking to you face to face, whether it's a one-on-one interview or it may be 2 or 3 people in the room interviewing. You want to have a list of questions for them specifically also.
Okay. And these questions could be about like the clinical rotations that the school offers and things of that sort.
Whatever questions you have regarding that particular institution are questions that you want to ask, all right? Because that shows that you're interested, of course, but it is also showing how the school, it's going to help you determine whether or not the school is going to be a fit for you too. Right?
Okay.
That's important. It can't be one-sided in the sense that you have to be a good fit for the school, and the school's got to be a good fit for you.
Okay.
Right? Because at the end of the day, you're paying the school to teach you how to become a dentist. And you're going to be there for over 1,300 days for the next 4 years. So you have to, actually it's more than that, it's maybe about 1,500 days. So you have to be able to determine whether that's a place not only that you get into, but like I tell lots of people, it's not where you get into, but it's about the ability to get through and get out.
Yes.
That's the goal. That's the goal.
So
those are some of the questions. That's why you want to speak to the students about, their student life, what their experiences are like as a first year, also as a second year, because those are usually the most challenging years, and those are the ones that can set you back in making your dental school from a 4-year program to sometimes 5 or 6, just because of things that are transpiring, or people have challenges that first and second year making that transition.
Okay. I'll be sure to do that.
Definitely.
Thank you so much.
Definitely. And I can help you with some of those questions, but most of that will come from you doing your own deep dive into information that you found either on the website or if you have a colleague of other friends that are also pre-dental students that are applying like yourself and having some interviews, you may want to use them as a resource also as to questions that maybe they asked specifically at the schools that they went to. Do you have any contacts at the school or any of the schools that you're applying to, friends that are current D1s or D2 students?
No, the only contact that I have at Meharry is my mentor. She graduated in 2014.
Okay, so a little over 3 years ago. So that's not too bad. I mean, she definitely kind of remembers that experience. It's not 20 years later where you might have forgotten. It's still kind of fresh on her on her fingertips and her tips of her brain, I'm sure, memories, I'm sure. So that's good. So you may even want to use her as a resource, as some questions to ask, possibly, or help you fill in the gap on some of your research that you're looking at.
Yeah,
from the school.
She's helped me.
Good, good.
She's very helpful.
So what other questions do you have relating to your upcoming interview?
Okay, so looked around at like potential questions, and my mentor has told me about like a few potential questions that she remembers. And the most common one is like, tell me about yourself. And like, you would think that would be the easiest question to answer, but I've been thinking about it, and I'm like, I don't know how far back I should go, if I should talk about like, you know, my family, or give like a brief like summary about myself like I just did with you. Like, I don't know if it has to be relating to dentistry, or if they just genuinely want to know who I am, even outside of like my interest in dentistry.
Yes, yes, and yes.
Okay.
So here's why. Number one. Here's why. Number one, I mean, you're human. You're a person, right? You're a person that's going to be charged with not only learning how to become a dentist, but also you're going to be charged with providing care to patients and making their care and their health a first priority. So, you know, admissions committees want to know about you. What makes you you? So when it says, you know, if that question tells me about yourself, I mean, they already know a little bit about yourself, but they want to hear you, but also see you and see how enthusiastic you are talking about this opportunity by coming to the school, being interviewed there, becoming a dentist in 4 years. All of that, you really doesn't have a lot of emotion unless it's face to face. So this is where you sell yourself. Well, I'm sorry. Yeah, this is where you sell yourself to the admissions committee as to why you should be accepted for the class of 2022. This is where you have to sell yourself. The first step of that whole process was applying and getting the interview, right? Because typically you can't get into dental school unless you have an interview. So the first step is getting the interview. The second step is actually, you know, killing and destroying the interview, meaning doing well, just blowing up the interview so that they have no reason not to offer you a piece of paper that same day maybe and saying, here, we want you to be part of our class of 2022. That's the type of effect that you're trying to generate and engender. That's the type of effect, so that when you leave there, you know, all they can be thinking about is Mercedes. We've got to get her in our class. We want her. That's the type of impression that you want to leave, because you only have about 5 minutes in that first part of that interview. You only have about 5 minutes, probably less than that, to make the best first impression that you can. So if that question comes up about tell us about yourself, just like you shared with me, you can say, hey, I'm here today. I'm so blessed to be here. I've been wanting to become a dentist since the age of 12, and this is the reason why. And you briefly talk about that experience. And then since then, how things that you've done in undergrad and also your master's work all has been related towards you becoming a dentist and sharing that background as it relates to who you are. And then the third thing you could talk about is, you know, what you envision, how you want to practice dentistry. You could talk about the compassionate care that was given to you, and that when you graduate, you may be thinking about pursuing maybe a doctorate degree in public health, or how you envision you using your DDS in combination with your MPH, how you envision using those 2 degrees to do what you are passionate about. That's who you are. That's what you need to convey, and that's what you need to explain and share with the committee.
Okay. That was great.
That makes sense?
Yes, thank you. That makes so much sense.
And
where do I start?
I was going to add one more thing. I'm sorry. And then you will find there's other people. There's dentists at Meharry and other schools that have MPHs. So one of the questions that you may formulate is, dentists that have MPHs, what are some of the common things that they do, or what are some of the opportunities that are created for them or that they create themselves? And, you might have someone on your admissions committee that has an MPH, and he or she may share some of the things that some projects or some things that they're taking part of, so that, again, it shows your interest, but it also shows how you are linking your admissions, your four years there, into the future, your future as a dentist that has a strong interest in public health.
Okay.
All of that is you. All of that is tell me about yourself, and what do we need? Basically, what they're asking is, what do we need to know about you that makes you unique? How's Mercedes unique from Mary or Marissa or whoever else that's also applying? Why are you unique?
Okay.
Why do we need to pick you versus someone else? Because remember, there's only but so many spots at each school, so they can't make offers to everybody. All right. Just thinking of top of my head, another thing that may come up that you may have to answer as a question is, they may ask you, well, how do you think you did on your DAT? And you may have mixed feelings about that. You may add or mention that, yeah, last year this is my second time applying. I didn't give up because I really want to become a dentist. And the only way I can do that is I got to reapply. I got to keep applying until I get into dental school. My DATs were X, Y, and Z. But just you have to think of possibly an answer or response to a particular question that may be geared towards your DAT. And you need to be confident.
Okay.
Be confident. Look them right in the eye. Or if you have to, pick a spot like right here on their forehead and look at that spot if you're having hard times looking at them face to face. But you should be practicing. Give yourself some time and actually take your camera, right? And practice talking into the actual camera, the open lens, and record yourself. Record yourself talking. Record yourself giving answers to questions, so that you can see and hear your body language, how you're looking, if you're making eye contact, all of those things. We look at, committees look at when we're conducting interviews, because it shows the level of maturity, shows your level of confidence. Okay. So
I'll definitely practice. I have
practice.
Yeah.
Practice. Yep. Okay. One of the things that can maybe help you as you're practicing is there's a lot of resources online through ASDA. Have you heard of ASDA before?
Yeah, I have.
Are you a member of ASDA?
No, I'm not.
Okay. Well, even if you're not a member of ASDA, there's still some resources that you have access to that'll help you with subjects like how to get into dental school, more specifically preparing for your interview. I'm on the site right now. They have some really, really good examples of things to do and to follow yourself. So I would go to that website to take a look for yourself, to really dive a little bit deeper, helping you prepare. The website is asdanet.org. asdanet.org. ASDA net.org. And go under the section for, I think it's get into dental school. And man, I'm telling you, there's a lot of resources here, one of which will really help you, which is preparing for the interview, what you should say, some do's and some don'ts. One of the don'ts is don't Don't tell lies.
Okay.
Don't make up stories. Be truthful.
Of course.
But you'd be surprised. You'd be surprised. People make up stories to kind of pontificate and make themselves, blow up to be more than who they really are. And admissions committees can kind of see right through that. So it's simple to do, but it's also simple not to do. So just be yourself, because at the end of the day, they're going to get Mercedes. They're going to get the person who's behind all of this. They're going to be getting you. So they need to know who you are.
Yeah.
So be yourself. Be truthful. Be yourself.
Okay.
I think there's a couple of other things that I wanted to share with you with your interview. Be relaxed.
Okay.
It's going to be kind of difficult to be relaxed, especially since this is your first interview. So you may not have been in this particular type of environment before. But just like you and I are talking right now, you want it to be, you want the communication to be free-flowing, go with the flow, but also know that you need to be prepared for questions, to answer questions that you should be anticipating.
Okay.
And have kind of understand, there's a couple things. I'm just going to read you off the website, which would be helpful as how you prepare for the interview. So, the first one says, know yourself.
Okay.
Right? You might want to explain some of the qualities that make you a good leader or team player. You can talk about your interests, of course, and things that you volunteered for, those types of experiences and activities that you've participated in. And then, which is all part of this also, being yourself, is being honest, like I said, and being humble. We don't particularly, I think being arrogant or just kind of like being known as the person who thinks she knows it all, may display that you're not teachable, not coachable. It could be a deal breaker. But so be humble. Be thankful again for the opportunity, like you've shared with me. You're so thankful for the opportunity to come in front of them today to talk more about this professional development activity and opportunity that you've been looking forward to for the last 10 years, ever since you were 11 and 12 years old.
Yes.
So that's one way to be prepared. Know yourself and know your CV, and know your responses and the content of your CV or of your application. You also want to know, you may want to find out this from your mentor, but find out the type of interview that you're going to have. Are you going to have a group interview? Will it be multiple interviews, meaning you're going to meet 3 or 4 different people one-on-one? Or are there going to be a group interview where you're going to be meeting 3 or 4 people in a group and they're going to be getting questions from here, 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 and here? So being able to know what the interview type may be will help you as you prepare and practice. Because if there's more than 1 or 2 people, if there's more than 2 people in the room, to really be an engaged person in the interview, you have to make sure that you're making eye contact. And when you answer, you're answering to everybody, meaning you have to kind of talk over here to that person. And as you're talking, go to the next person that's in front of you. And then as you're talking more, go to the next person that's to the left or right of that one. And that shows how you're paying attention to each and every person that's in that type of group interview. Versus on one-on-one, you want to focus on talking to, of course, that person that's in front of you. So you want to match your practice and your mock interviews with different types of scenarios, whether it's one person or more of a group, and that that type of format.
My mentor had mentioned that that she was like, she had said something like, be ready for like a group interview with other interviewees. So she was like, that they might throw you into one of those situations just to see how well you stand out in a group and how comfortable you are. So I wasn't aware of that before she told me. So I was like thankful that she told me that.
That's part of the being prepared, knowing the type of interview type that you're going to get, group, one-on-one, and it may be a combination of both or three. That's why you have to practice in all three, you know? One of the things, you know, as a group, if you think about it, when you're in a lecture hall and there's a question, or, you know, some schools work where the learning is in groups, in small groups. So you're interacting with one another, you discuss things, and then you guys may be presenting to the faculty member as a group or as a representative of the group. Other schools is straight, you know, you're on your own. You know, it's from faculty member to 50 or 100 people. You know, there is not a lot of group dynamics. So, you know, people, you know, we want to see how you interact in those different environments, because as a group, as a member of the class of 2022, you know, you're going to have both group and individual activities that you're going to be responsible for. So that's why, you know, they want to see you in a group setting also, and see how you interact. How you interact with others is key. Another thing to be prepared about is, you know, being able to explain specifically why you want, why you want to go to dental school and what you want to get out of it. And that should be 2 or 3 minutes. Quick answer, you know, why you're pursuing the profession, and just be confident and clear as to what that why is. They also may ask you some questions about current events and what's going on in dentistry right now that may affect you as a student and as a future practitioner in 5 or 10 years. So you need to be conversant on some of those issues, which are, number one, one of the things is student debt. That's a big issue right now. How schools are helping students manage or getting prepared to manage their school debt. Big topic, big concern for a lot of new dentists. Right? So there's issues with that. There's also issues with you know, where are new dentists practicing? Are they opening up their own practices, or are they going into corporate practices, or what we call DSOs, or dental service organizations that kind of provide some services for offices, but you as the dentist are the owner of the office, and they're just kind of as an adjunct set you up with some of the business and other ownership capabilities to kind of run your business. That's a topic, a current topic right now, a hot topic. Okay.
Is practicing.
Yeah, that's a big topic. Another topic that's coming up in certain parts of the country is having these dental therapists. So I would Google dental therapy, and depending on where you get some of your interviews, your state where the school is may be affected or may be involved in legislation that is concerned, that's working with bringing dental therapists into the state. Just a brief overview. It's happening right now. It's happened already in the state of Minnesota, where they've proposed using dental therapists in the place of dentists in some areas of rural Minnesota, because there's a lack of access to care for some of the people that are looking to have oral health services delivered. And it's catching on in some of the other states, one of which may be, you know, a state that you may go to, and how does that affect you as a licensed dentist? Is an issue that could be coming up, that the school may be dealing with. Depending on which school you go to, it may be an issue for the school. So being conversant on those types of issues that are going on in dentistry help you do that. And one of the ways that you can continue to learn, not only now for your interview, but also for your career, is, you know, the ADA. I would Google the ADA and ADA news. They will have stuff on their website about different topics that are happening in dentistry. Another source to help you continue to be conversant on things that are happening specifically in dentistry is this company called Becker's, Becker.
Becker's.
They have what we call a Becker's Dental Review. You can Google that, and you can find out. You can see I think every day I get something from them. You know, today in the news or this week in the news.
Okay.
So those are things that you want to be able to have at your fingertips, or in this particular instance, on your tongue tip, on the tip of your tongue, so that you can hold a discussion and, you know, show to them that you're here for a reason. You're passionate about it, but this is how you're passionate, because you are very aware of the issues that are going on, how it affects patients, providers, but also some of the issues that are affecting new graduates or dentists, new dentists that are coming out.
Okay. I'm going to do my research on those topics.
Yeah. And I would say there's
and I'll probably come across more topics too.
You will, but just have an overview so that you can be conversant in it. And, you know, you may only need to give a blurb for 10 or 15 seconds of certain different topics, you know, but don't just talk about it just to spill it out. Talk about it as it relates to maybe a concern that you have or a solution that you're looking to solve later on as you go into the field of dentistry after graduation, and how that impacts, how that may impact you. Okay,
I'll do that.
And then the last thing was that I saw that I thought would be very, very helpful to help you, again, prepare and give yourself an idea as to what the interview is going to be like. On that same ASDA page, they have a list of potential questions. And there's probably about 10 or 12 questions on here. And I'm going to give you a couple of them. One of them says, have you had any experience with dentistry? Second one, what differentiates you from the rest of the applicants? You know, AKA why you? Why should we select you? Why should we choose you? So you need an answer to that. You definitely need an answer to that question. What other dental schools have you applied to? Have you interviewed there? What event has made the biggest impact on your life? What event has made the biggest impact on your life? Let's see. We noticed that you withdrew from a class. Why? That may or may not. They may say, well, we noticed that you took the DAT once and your score was X, Y, and Z. How did you think you did on the exam? Would you take it again? Yada, yada, yada. So that might be something that might come up. You know, do you have plans for after graduation, and what are they? Where do you see yourself in 10 years? Right? What would you say, or what would you do?
So like the long-term, short-term goals.
Yeah.
Okay.
Yep. 3 years out, dental school, 5 years out, maybe 10 years out. Now all of that's going to change in 4 years, but still it shows that you are thinking, you're forward thinking enough, because then it allows you to plan now for later on.
Okay.
And another one is, what would you like to improve about yourself? Or AKA, you know, what are your strengths and what are your weaknesses? When it comes to your strengths, you want to highlight those strengths as it relates to you as a student at the dental school, and you as a graduate of that school as an alumnus. That's how I would answer those questions.
Okay.
Yep. That's how I would answer those questions.
So,
Because go
okay.
ahead.
So I should be sure to connect my strengths and my weaknesses to the field of dentistry.
Absolutely, but also as it relates to you, because again, they're bringing you in to find out more about you and whether or not you are going to be a fit for the school as it relates to one big thing. If we admit her, is she going to become an alum? How is she going to be able to? Will she be able to get through the rigors of the first 2 years, and then also the third or the fourth year? All right, that's what we're trying to find out. Are you a fit for the program? And another thing that you have to have an answer to is, how are you going to contribute to the program, or in this particular sense, the school? What are you bringing to the table? How are you going to contribute to the school as a student? It could be as, leadership positions. As an alum, it could be working with the local alumni in the area of the country that you're in. Could be donations,
Okay.
Many different things. But yes, tied into why you and how it relates to your purpose for being there. Your purpose for being there is to get an acceptance letter saying that you're in the class of 2020. I'm sorry, 2022.
Okay. 2022.
Yeah, last time I checked, dental school is not 2 years, so that would be amazing.
Yeah, that would be great, huh?
Mm-hmm.
Okay, this is really helpful. I'm glad that I have like a week and a half to prepare some more and just to go over all the questions that are online and some of the questions that you've given me. So I'm definitely going to do that. And I'm anxious, but I know that I have to let it all go.
Yeah, well, it's good that you're anxious. But you're only anxious for one reason, because this is your first time interviewing for dental school.
Yeah.
So it's a good anxious. It's a very good anxious because let's see, 1, 2, 3, 6, 12. To about three years ago, the number of dental school applicants were about 13,000. Guess how many got in the class of 15, 16? Guess how many got in of 13,000?
Like 3,000.
A little bit more, but more like about 6,400.
Oh, okay. So like half.
Like half.
Oh, like half.
Right.
Oh. Yeah.
So when you've gotten to this stage, I mean, this is a blessing also to get to the interview stage, to become, to put yourself in the pool of that 50% that get in after applying. So yes, 50%. That's why you're a little anxious too, because only half of the people matriculate. So, but when you go, you make sure you have your list. It's okay to have your list of questions in front of you. Have them already laid out.
Okay.
That's going to be great. You know what that shows? That demonstrates that you are organized, you're systematic, you approach things with forethought, in the sense that, all right, I know they're going to ask questions, and I know they're going to ask me if I have any questions. Yep, here they are, right here. Boom, boom, boom. And you have them right in front of you, ready to go. You don't have to have them stuck to memory. Bring your pieces of paper. When they're talking, you can take notes.
Okay.
Sometimes when they ask a question, a quick tip, when they ask a question, you should repeat it. Even if you're repeating and say, hey, I'm just want to write that down, make sure I got it right. What is my plan, my 5-year plan after dental school? You write it down, and boom, Now you've got a question that you can target and give an answer to. But if you ever find yourself just kind of rambling, you can go back to your piece of paper and look at the question to remain focused on answering that question. 2 or 3 minutes, maybe three to 5, no more than 5 minutes for each question should be fine. But try to stay 2 to 3 minutes if you can. Be concise, clear, right on point, and be prepared so that when they have their question, after they finish their questions, you can turn your page and be like, yep, here are my questions. And base those questions based off of what you've heard and what you've been discussing with them, because 1 or 2 of them on your list may have already been answered.
Okay.
Yep. So you're supposed to be anxious. That's good. That's good.
This is so helpful. Okay.
That's good. You're supposed to be anxious.
This means so much to me. So I'm like maybe my anxiety is too much right now. My anxiety level is.
Well, that's what they need to hear. They need to hear why you want to get into dental school. This means so much to me because as a dentist, I can help so many more people like I was helped, or it means so much to me because of X, Y, and Z. Whatever that is, whatever's true to you is true to you. So that needs to be explained and shared with the committee.
Okay. Thank you, Dr. Hayes, so very much. I'm so grateful. I'm so thankful for the opportunity to speak with you. You've actually relieved some of my nerves. It's gone down a bit.
Good. That's the purpose. That's the goal.
I'm gonna
get you into
practice
the of 2025. Yeah. I'm sorry, 2022. I keep saying 2020.
Me too. I should have already been in dental school. That's what you're saying.
Nah, well, you may feel that way, but it's always for a reason.
Yeah.
The actual big tooth fairy in the sky. She has a plan for you specifically.
What'd you say?
I said the big tooth fairy in the sky. She has a specific plan just for you.
Yep. Oh.
Now, one last thing I want to share with you in preparation is once the interviews are finished, or one of the things that you should be thinking about when you meet people in the interview, ask for a business card.
Business cards, okay.
Ask for the business card because there's a phrase that goes like this. The fortune is in the follow-up. The fortune is in the follow-up. So what do I mean by that? In this particular case, your fortune is getting accepted into dental school, getting through dental school, and becoming a graduate, and getting your DDS or DMD, depending on what school you go to. In order for that to happen, you need to follow up with these people that have interviewed you, that have taken the time out of their schedule to talk to you, but also that you've been able to share that information of why you want to come to this particular school and why you want to become a dentist. At the end of the day, when you're gone, you want the things that you said in the interview, and you want your face to kind of reappear in front of all those people that are on the committee. And one of the ways you do that is by following up and giving one of these. Can you see this? It's a thank you card.
It's a thank you card. Okay.
Thank you card. So one of the ways that you're going to follow up so that they stay, so that you stay on the missions committee's mind is not only your interview and how you project yourself and present yourself, I should say, but also little things like sending thank you cards and or thank you email. Now I will tell you, it's simple to do, but also simple not to do. So much so that not everybody's going to do it. Some people will send an email, but everybody gets emails, right? You probably have at least 150 emails in your inbox right now. You ain't even looked at.
You're right.
And one of them could be an email saying that you won $50,000, but you won't even get to it.
Oh, I hope not.
I hope not either. But my point is, everyone gets emails.
Right.
To the point where, you know, they may check them, or they may just gloss over them, just look over them very nonchalantly. But when you send somebody one of these and it's addressed to them, and they actually have to open it up and see your handwriting, and you say, thank you for your time. I'm glad we were able to, thank you for sharing information about X, Y, and Z. That's another reason why you want to take notes during your interview. That when you meet with people and you find out it's Dr. Smith, or it's Dr. Davis, or it's Dr. May, when they ask a question and you share something with them, write a little note as to what the topic was when you were talking to Dr. Davis or with Dr. Hayes. You just write a little note so that when you do your thank you notes, you now have something to make it even more personalized than just saying, thank you for my time, thank you for talking with me, I look forward to being admitted into the school, yada, yada, yada. That's what everybody would say. But now you've gone the extra 3 or 4 steps by getting something specifically that you and that person on the committee talked about, and you included it in here. Even if they don't remember, the fact that you remembered is important. That's one of the ways that you're going to be able to stand out, not only during the interview by paying attention and answering the questions from, if it's a panel, answering the questions right back to Dr. Davis and knowing who that person is, or Dr. Smith, or Dr. Branch, or whoever it is, by addressing them directly, but also following up with them directly through this tip.
Okay. I'll be sure to do that.
Yes, but that's why you want to get their address from their business. That's why you want to get their business card, so that you can get their email address, but also their mailing address, because it could be different parts of the school.
Okay.
And I think with that,
I'm just taking notes.
Yes, and I think with that, I think you will have a very, very successful interview day next week.
Thank you.
And if you want to practice, if you have a list of questions that you think are going to be asked of you, if you want to go down or we want to practice, let me know. I'll find some time we can practice in front of the camera, and I can look at your response, your body language, and everything else. Or better yet, you can even have a friend who records you, and you just kind of look into the camera. The only problem with doing that, sometimes you can get distracted. You're focusing more on trying to see yourself in the camera than you are actually talking naturally, like you're going to be in front of somebody. That's the only caveat, But maybe if you can put the camera up on your laptop somehow, or even just use your laptop. If you have a laptop that has a camera, just hit record if you have, depending on what app you have, and just record yourself looking into the camera as if you're looking at a member of the committee, and just answer the question. Be you. Be Mercedes.
Okay. I will. Thank you so much. Oh my goodness, you've helped me so much. I'm definitely going to keep in contact with you. I'll let you know. I'll probably speak to you before my interview, because my nerves will probably go up again. So I'll definitely contact you, and then after the interview, I'll let you know how it goes. And I'm hoping and praying that it goes well and that the outcome is what we're all hoping for. So.
Well, you made the first step in making that all go right, which was reaching out to me and other people that you have in preparation for this professional development opportunity. This is why you've been doing what you've been doing over the last 10 years, so that you can get into dental school. So let's get you in school. So I'm so glad you were able to link up today. And if any of you are getting prepared like Mercedes for an interview, and you want to practice or you have some questions, feel free to contact me at NewDentistCoach@gmail.com. NewDentistCoach@gmail.com. Send me a quick email about your question, your concern, your fear, and we'll figure out how we can get you some help. Thanks so much today, Mercedes. Good luck to you, and I'll be talking to you soon, okay?
Thank you, Dr. Hayes. I really appreciate all your
You're
help.
welcome.
Thank
You're
you.
welcome. Good luck to you, and I'm sure everything will be fine. You'll be good.
Thank you so much. Have
You're
a great
welcome.
night.
You're welcome.
Take care.
All right. So
Thank you.
you're welcome. So I have, let's see. Yeah.